after heart surgery. They have, this would be in their IJ, their internal jugular vein, and it would have something that comes out here where we could administer fluids, sedation, other medications, blood if needed. This is a catheter that goes through that device and measures pressures within the heart, pulmonary pressures, central venous pressure, cardiac output, cardiac index, and it has many different lumens to do all of that. We have chest tubes where we monitor chest tube or drainage output, and there's a little device down here to quantify that, a Foley catheter, a bladder catheter that goes into the patient's bladder and drains urine here. And then we can quantify that as well. Sometimes the patients are paced, and I think that's what these wires are here, pacing wires that'll hook up to a pacer box and pace the patient's heart. And this would be an arterial line that comes out and measures blood pressure with every beat of the heart. Much of that goes up here. The patient will have continuous infusions, usually to keep the patient's blood pressure up, help the patient's heart to beat better, keep the patient sedated, sometimes insulin to keep their blood glucose under control. And then, the more you see, the more you'll know how much technology plays a role in our field. And this would be hooked up to a balloon pump, which aids the heart and aids how well the heart functions. It goes usually through the groin up into the aorta, and then inflates every 1 or 2 beats of the heart, or so, maybe 4 beats sometimes.